Good afternoon. My name is Adolfo Martinez Valle, and let me start by thanking Hira for being here today and sharing the Mexican experience in the context of the Latin American region. Let me very briefly share the screen. And today, basically what I'm going to talk about is first, give you a very brief introduction and give you a profile of my country, Mexico, before the COVID-19 pandemic started. Then I would like to answer whether the Mexican health system was prepared to face it. And I will devote most of my presentation on analyzing how the pandemic is being addressed. And finally, provide some global lessons for Mexico. So how was Mexico before the COVID-19 pandemic started? What this map shows is Mexico, how heterogeneous it is a country in terms of socioeconomic status. And despite being a middle-income economy, still it suffers from persistent socioeconomic inequalities. What the map shows here is how my country looks like in terms of percentage of poverty. And as you can see in the southern part, most of the states here, most of the people that live here that are born poor remain poor. And and the poorest country is Chiapas, which is almost 80% of its population are born poor and remain poor, in contrast to the northern part of the states that are on average 30%, or Mexico City, the nation's capital, which is around 13%. So I would like you to please have in mind this mosaic of a country in terms of socioeconomic characteristics during the presentation. Another factor which usually is neglected is the political landscape of the country. And let me just very briefly tell you that currently we now have a new political movement rather than a political party in office. This is our current president, who's been holding office for 2 years now. And not only does he is being the president of our country, but also holds a majority both in the House of Representatives. Nearly 50% of its members are from his political party, Morena, as well as the members of the 128 seats in the Senate. But the most important thing, besides holding enough power to pass laws and basically to have a very big mandate, is that he seeks to transform Mexico. He wants to change everything, and by that, he first wants to destroy its current institutions. What does that mean in terms of our health system? Well, first, he's gonna destroy. He currently has disappeared Seguro Popular, which is one of the it's the public health insurance scheme that covers most people in Mexico, especially the poor. It covers around 50% of the population versus the other half of the population that is covered by Social Security. What this means is that our health system is basically an employment-based health system. So if you have a formal job, either you are covered by IMSS, if you're in the private sector, or by ISSSTE, if you are employed by the government. The rest of the population is covered by, or used to be covered by Seguro Popular, who's now been transformed into a new institution called INSABI, which we still don't know how it it is going to operate. And we still have a very small, around 15% of the population that has no access at all. And this is basically population that lives in very marginalized places, the ones I showed you in red at the beginning of the presentation. In terms of funding, we are still a very underfunded health system. It only allocates 3.2% of its GDP for health. And we still have a very big out-of-pocket share of its financing, being 2.8 in the private sector, which we'll see. As you will see in the next slide, it's basically to cover, to purchase drugs, around 63%. And even though in the past 15, 20 years or so, out-of-pocket expenditures has been reduced from 54 to 43%, and the share of public expenditure is it's higher than the share of private expenditures. We still have a health system that allocates most of its resources to curative care, around 80%. And as I said before, when it comes to purchasing drugs, it is paid out of pocket. What does that mean in terms of the performance of the health system? Well, we'll still lag behind the OECD average health indicators. And if we review some of these indicators, we're not so bad regarding life expectancy. We're only 7 years behind. When we see the neonatal mortality rate, which is an indicator very sensible to the quality of medical care, we still have a mortality rate 4 times higher than the OECD average. Again, another highly sensitive indicator, the maternal mortality, is 43, despite having achieved the Sustainable Development Goal. We are still very, very behind the OECD average indicator. And regarding the 2 indicators that are related to something that it's been increasingly becoming our highest burden of disease, diabetes and ischemic heart disease, we still have a lot to work on. Well, what this means in terms of our COVID-19 current pandemic is that our country here, what this map shows is that is the number of positive cases at a lower level of aggregation at the county level, and what you see in red is the counties that have the higher number of cases. And as you can see, both in the northern part and in the southern part, we have reds. So even when we do a more refined analysis at a lower level of aggregation, we see a much more complex, much more complex country. So the question is, was the Mexican health system prepared to face the pandemic? And the short answer is yes. In theory, Mexico was relatively prepared to face a pandemic. What this map of the world shows is how prepared the world was in terms of this indicator, the Global Security Index, which is an indicator that was developed by Johns Hopkins University and the Economist Intelligence Unit after the Ebola crisis. They wanted to measure how countries were prepared, and Mexico, as most of Latin America, has nearly an index of 60%, which is relatively okay compared to Africa and even to most of Asia and to Europe. And but when we see the preparedness of our host country, South Korea, we are still a little bit behind, and that's why we see the map with so many reds that I showed you earlier. Compared to the US, for example, that it has a higher number than South Korea, it's 83. So what this probably means is that this global security index it's an indicator that isn't reflecting really what the level of that we really weren't prepared for the magnitude of the pandemic that we are facing. Going forward, in terms of, as I mentioned earlier, in terms of health financing, I told you earlier that nearly 3% of GDP is allocated to health, to public health expenditures. And if we go back in time and we see what we were spending back in 2008, we are spending more, but in 2015, when we reached our highest number, we're still a little bit behind. And what this shows you is that, at least for these two past years of our current government, health has not been really a priority in terms of its share of total GDP, even though that we're facing the pandemic. For next year, we aren't increasing much our healthcare expenditures. In terms of our healthcare workers, and here I am only showing the number of practicing nurses per 1,000 population. Mexico has a very small figure, 2.7, compared to the OECD average of almost 9. We are a little bit behind Korea, but not so, with 4.7. But we are, compared to other Latin American countries, even though we are better than Brazil, it has 1.5. We are behind Chile, which is 3.3. So how is our country facing the pandemic right now? And let me start by saying that the communication strategy has not been very effective, basically because it has not been scientifically based. Our current president doesn't seem to be taking very seriously the pandemic, and he has made remarks such as, you have to hug, it's okay. Even on March 22, when we had a lot of cases back then, he invited Mexicans to come to restaurants and enjoy with themselves in public places. And in the picture here, he invokes religious lucky charms to face a pandemic. And from the beginning, he has consistently refused to wear masks in public events. Here you see him in one of his daily morning press conferences. Let me show you now some findings of a recent analysis I have undergone on how Mexico performs related to other Latin American countries that have similar population countries and that have similar life expectancies at birth, to make them more comparable. And what you see here is the Oxford Health Government Responding Index, which is an indicator that measures 13 indicators that measure the different kinds of mitigation policies and other health policies, such as COVID testing and tracing. And as you can see, Mexico, which is in red, not only did it start later than the other Latin American countries, but it also started with a very low level of response and remained so until by the end of September. So Mexico, compared to other countries like Argentina, which started earlier and with a high government and with an index response of more than 90, Mexico has on average have a response of 65%. even Colombia or Chile are doing better. The only other country that has done not so good job as Mexico is Brazil, and you have seen also the consequences of that, as I will show you in the next slides. Furthermore, another indicator that the Oxford University measures is whether the governments have responded by providing economic support. Remember that, as I showed you at the beginning, not only Mexico, but every Latin American countries are suffers from very high social inequities in terms of economics, and it's very important that Latin American countries have this support, and Mexico hasn't provided any economic support at all. The other thing is that the Mexican government has underestimated the importance of performing a large number of tests to detect and trace cases, and this slide shows you that. See how little tests per million population by July 1st Mexico has implemented versus Chile and other Latin American countries. And the other thing is that it hasn't provided the required protective equipment for its healthcare workers, and Mexico, compared to very poor countries such as Peru and Bolivia, has much more medical personnel deaths, and even so much more than the US, that has the double size of its population, and even Brazil that has a larger population than Mexico as well. And what you see in this graph is how these previous policies measured with the Oxford Government Index whether they have had an effect on reducing mobility reduction in public recreation areas. And as you can see, the measures implemented have not been able to reduce mobility in Mexico, which is here shown in purple. Mexico is on the top of the chart, together with Brazil, and has reduced much less its mobility compared to Argentina and Chile, which I showed you earlier, had indexes of 80, between 80 and 90% versus Mexico that only had 65%. Even Peru has done a better job, even though it has ups and downs. What we see here is that these less effective mitigation policies are associated with higher number of cases. But even though Mexico here in red, you see that here we see the cases since March through early October. And even though Mexico seems to have a low number of cases, this is not because their policies have been effective, but rather because they have done much less comprehensive testing, as I showed you earlier. Countries that have performed more tests, like Chile or even Argentina, show higher number of cases. This is, of course, adjusted for its population. These are cases per 1,000 population. And you can see, even though Mexico has more or less the same cases throughout the period, it has an important undercounting of cases. But when we see another indicator, the mortality rate related to COVID-19, the deaths per 100,000 population, this is how the mortality rate has behaved through October 8. We see that Peru is the country which has the highest, followed by Brazil and Chile, but Mexico is very near, around 63. But remember that Mexico has an important underreporting of cases, and it's higher than Colombia and Argentina, which have done a better job by implementing more strict public policies to reduce the number of cases. Sorry, I went a little bit back. Here we see also that there is evidence from the economists that the excess of deaths and weekly death rates may be higher than other Latin American cities or countries because of its considerable underreporting. There's a lot of studies that have shown that. And what the graph shows here is the excess of deaths compared to the deaths that were expected compared to last year's. And you can see that it's higher than Peru, which I showed you earlier is a country that has the highest mortality rate of all the 6 countries from Latin America that I have analyzed. Finally, what are some global lessons that we can learn from the failed experiences in Mexico, but also from the best practices from elsewhere, from all around the world? And I think we can identify at least 6 policy lessons. Probably the first one and most important is that you need to establish a clear communication policy, including transparent monitoring and evaluation. It is absolutely strategic to have good numbers to really know where you stand in order to address more effectively the pandemic. And this means to implement a more comprehensive testing policy. Also, you need to enforce a compulsory nationwide use of masks, which hasn't really been done in my country. In fourth place, you need to practice strict social distancing. And even though this is quite a challenge in Latin America, because we have as I showed you earlier, a high percentage of the people live in poverty, and their main source of income is from the informal economy. People cannot afford to stay at home. We still need to practice social distancing and wear masks. The fifth lesson, The fifth lesson is to implement confinement policies targeted to higher risk and COVID-19 incidents. We have seen now that even though as I showed you in the map, that COVID-19 is spread all over the country, there are some places where you saw the reds, we need to target our confinement policies. And finally, we do need to provide economic support to both persons and businesses that are unable to stay at home because of their socioeconomic situation. And finally, the final lesson is that it is never too late to straighten your course. The pandemic is far from being over, and we really need to take care in each of our countries. Here is Mexico in bed, convalescent, and if we don't take this pandemic seriously and are more strict about implementing the public policies that we have now, we still, our best weapon is public health measures. Medical care is not a solution. We really need to be more strict about it. And please, if you have any questions or comments, please email me at this address. Thank you very much for your attention.